As a cancer researcher, as an oncologist, where do you see the field going forward over the next decade?
I think moving forward, as you've alluded to, treatments will become more specific and more tailored for an individual person. My great hope for SFT is that we will be able to use FAP-directed therapy to bring benefit to patients. And I'm really optimistic that this approach will be successful over the next 5 years.
And I guess one other question on that is, I don't know if there's a great standard of care, but if you're on the standard of care therapy, which would be anti-angiogenic agent and maybe, a classic chemotherapy type agent, that if somebody has been on that and they say, well, my disease is controlled versus someone who says my disease is no longer controlled, when would you encourage someone to access a clinical trial? Because sometimes people say, well, I'm not really curing this, but I'm just in a holding pattern. So you hate to upset what is working for something that may or may not work, but that's always a challenge for people to know when to switch therapy just based on, the availability of technology as it develops.
I usually tell people about clinical trials at any point for treatment of metastatic disease. I'd say that clinical trials are really important, particularly, as I say, in the UK, where access to medications can be challenging. And I'd almost say that clinical trials are part of the strategic approach to treating the cancer, so that if we use a clinical trial early on, people can always fall back on the standard treatments after that.